I'm going to talk about home health care coverage and something that we all should be thinking about as we get older, and especially as we're coming into Medicare. And this program is designed specifically for people already in their 60s and 70s, and I think it's a great idea. So stay tuned. Okay, let's talk a little bit about home health care coverage, and certainly a topic that's uncomfortable for many because we just don't want to look down the road and see where we may need some type of long-term care coverage in our future. Fact of the matter is, most of us will, so we absolutely need to address it. And what I do is I try to find things that I find valuable that I think you will find valuable and are also very easy to use and affordable. So here we have an alternative to traditional insurance. So this is not traditional insurance. And this video, if you'd like to get back to it at any time or if you'd like to share it, created a URL. It's at www.homecaremembership.com. So if you'd like to share that with anyone, and actually I truly think you will when you see exactly what it's about, just go to homecaremembership.com, brings you right to this video, makes it easy to find. So again, we have an alternative to traditional insurance. So this is easy to qualify for. There is no underwriting, there are no health questions, and there are no age limits. So it's really designed specifically for people that are already in their 60s and 70s. And if you've gone to look at long-term care coverage anytime recently, you've certainly found it to be quite complicated, and it's very difficult to understand how it's going to function now, how it's going to function in the future. With inflation, what are things going to cost 10 years from now, things like that. It's been very complicated. It's also been prohibitively expensive. It's very expensive, and the reason that it's so expensive is because it has high utilization, which reinforces the point that yes, we are going to need some type of long-term care coverage in the future. So that's why I'm bringing this to you. And this company, True Freedom, is actually local in my area, and I've met personally with the owners, and I'm comfortable with exactly what they have to offer. It's perfect for what I think is right for a lot of people, and I'll show you exactly what it is. I'm going to show you how much it costs, so stick with me for just a minute. I'll also show you another video right at the end of Dr. Marion Summers, who has been a career senior healthcare advocate her entire career, and she thinks this is a terrific plan as well. So I'm going to show you that. Just it adds a lot of credibility to it and something I think you'll find pretty interesting as we go forward. So let's talk about Medicare real quick. And most people go, well, doesn't Medicare cover home health care coverage? And the answer is kinda. You know, they cover some, but there are major gaps in what they do. And you can see right here, for home health services, how is it covered under Medicare? And shows Part A, Part B covers eligible home health services like these: part-time or intermittent skilled nursing care, part-time intermittent home health aid care, physical therapy, occupational, speech language. What most people need is more than intermittent care, so it makes it very difficult to utilize Medicare for when you need more than intermittent care. So usually a home health care agency coordinates the services that your doctor orders for you. So in order to do it through Medicare, your doctor has to be in charge of it. And that's another problem with a lot of folks, is it doesn't give them any control on how it's going to happen. So things Medicare does not pay for: 24-hour daycare at home, meals delivered to your home, custodial personal care, and homemaker services. And those are a lot of things that people absolutely need, and this is what this plan is going to address. So I'm going to show you exactly how it functions, and again, I'll show you exactly how much it costs. It's super easy to use, and that's one of the big check marks on my list, is making things simple and easy to get. So who is eligible under Medicare? So if you were still under Medicare, how do you get home health care services under Medicare? Part A and Part B, who meet all of these conditions, are covered. So you have to meet all of these conditions in order for Medicare to provide home health care coverage. You must be under the care of your doctor, and you must be getting services under a plan of care created and reviewed regularly by your doctor. So again, your doctor is 100% in charge. You must need, and a doctor must certify that you need one or more of these: intermittent skilled nursing care, physical therapy, speech language pathology, so on and so forth. You must be homebound. and your doctor must certify that you are homebound. In other words, you have to be in a position where you cannot leave your home. Now, Medicare does give you the ability to leave your home for certain things, like attending religious services, getting home health care if you attend adult daycare. God forbid we attend adult daycare. But that is the restrictive part about Medicare and home health services that most people don't understand until they get there. So that's why it makes a lot of sense to have a plan like this in place where you call the shots. And I'll show you in just a minute exactly how that works. So you can see here, your doctor or other healthcare provider may recommend services more often than Medicare covers. They may also offer services that Medicare does not cover. So a lot of times your doctor wants you to have things that Medicare just does not cover. So that's why we need to address it ourselves. And True Freedom does just that. And again, it's an alternative to traditional insurance. So it's very easy to qualify, no questions, no underwriting, no age limits. The only caveat is you cannot currently be having home health care services, or you cannot currently be incapacitated and homebound. If you are not currently receiving home health care services and you want this plan, you can get it. All you have to do is sign up. So it makes it super easy to do. So we're going to figure out exactly how that works, and I'll show you kind of what it entails. But first, what does this plan feature? And pretty simple, field issue contracts. And that's something that just makes it easy for me to bring it to you. So a good thing there. No underwriting, no claim forms, no deductibles, no copays, no age limits. It really ought to say no hassles here, because again, it's completely at your control. So the plans provide up to 24-hour-a-day coverage, 7 days a week in the comfort of your home. So that's, I don't see any restrictions there. So it makes it super easy when you need it to be able to have what you're looking for. So the different choices and plans, they have 4 options, which I also like. They don't overcomplicate things. They have a bronze plan, a silver plan, a gold plan, and a platinum plan. And really the only difference between them is the amount of lifetime hours. So in these plans, what you are doing in essence is you are purchasing access to home health care hours of service. So that's what makes it pretty interesting for inflation, is you're not buying the dollars to buy the hours, you're actually buying the hours. So that way, whatever they cost now versus whatever they cost 10 years from now doesn't really make any difference. You have the same amount of hours. So you can see here at the bottom, agency and anytime services include meal planning preparation, assistance with dressing, assistance with bathing, grooming, laundry, grocery shopping, light housekeeping, monitor diet and food expirations, medication reminders, accompany to places of worship, accompany you to a doctor's appointment. These are all the things that Medicare pretty much doesn't cover. And again, it's all at your direction. So you are in control of what you want to do with your plan. And when you see it says agency or anytime services include, what is the difference between agency and anytime services? And again, something I think is fantastic with this plan. The True Freedom Premier Plan includes 2 options of non-medical home health care services to choose from. Members can select to utilize either agency hours provided by a network or licensed or registered home care agency in the True Freedom Network. So in other words, you would have a regular agency person, you would call, they would schedule, they would come to your home. Or you can have anytime hours where members have the freedom to choose a friend or a neighbor to provide their home care services. The only caveat there is it just cannot be a family member. So if you are one of the lucky ones where you have that super helpful neighbor that's always there to help when whatever comes up, and you need some help, wouldn't it be fantastic to be able to compensate them for the effort that they put out to help you? Or maybe you don't have that super helpful, nice neighbor. It would be easy to find one if you have compensation for their services of their time. So a terrific option that you can use somebody other than an agency to provide services. So you can see here, anytime hours provided by a friend or neighbor are available any day of the week and during any all hours, including overnight, 24/7 live-in home care at your direction. Very simple to use, very easy to have. Or agency hours. If you want to use an agency, you simply are call it an agency. They generally work up to 5 hours a day, Monday through Friday. Between 9 and 5, they come to your home and they do the things that you need them to do while you're incapacitated or things of that nature. So this is just a terrific option that I think gives you all the freedom, gives you all the flexibility, gives you all the control. So it works out very well. So some of the features are premium rejuvenation, and this is, or premier rejuvenation. And this I think is terrific. So it runs in kind of bundles of hours. Within whichever plan you choose, you get bundles of hours. And at the end of each bundle, if you have a 90-day window where you do not use services, so only 3 months of time where you don't use services, it rejuvenates and your services come back again. So it gives you the ability to have coverage now and certainly in the future. Inflation protection, like I talked about just a minute ago. You don't have to worry about what things are going to cost in the future because you're not purchasing on a dollar basis on what things are going to cost down the road. And then a discount reward program, which I also think is a terrific idea, where if you have this plan, just like any insurance plan that you might have, you don't really want to use it. So under here, if you have this plan and you are not using it, each year your premium will go down by 10% with a maximum of 4 years. So if you have this plan and you had it for 4 years and you did not use it, your premium will be 40% less going forward. So a terrific idea for both the company and for you to be able to kind of save money even though you're not using the plan. So a terrific scenario. So here are our choices and the costs associated with them. So you have a bronze, a silver, a gold, and a platinum. The bronze plan is 1,500 lifetime hours and it's $95 a month. So again, very affordable. If you've looked into long-term care coverage of any kind, significantly higher in cost than that. A silver plan, 3,000 lifetime membership hours, $175 a month. Gold plan, 6,000 is $295 a month, and platinum is 10,000 hours, $475 a month. And what I would do is, if I were looking at this, and like I say, I met with the owners and we talked about their different options and what people choose. They pretty much have an equal distribution between all 4 of these plans. So a lot of people pick the platinum plan, a lot of people pick the bronze plan. It just depends on your comfort level and what you're looking to kind of accomplish for the future. If it's me looking at it, I'm probably looking at the 2 in the middle. So either the silver or the gold. And what I would want is the most coverage that I could have where I'm still comfortable with the budget side of it. So just figure out from a premium standpoint what you're comfortable with and then kind of choose it from there. Now you can see there are also discounts. If you pay your premium annually, it gives you a 5% discount. If you and a spouse or a domestic partner come on together, it gives you a 10% discount. Or if you and a spouse or domestic partner come on together and you pay your premium annually, gives you a 15% discount. So significant discounts on the premium. And I would absolutely recommend the annual discount because it just makes a lot of sense to save 5% right off the bat without really doing anything different. And if you are in position to have a spouse or a domestic partner come along as well, it just makes it that much more affordable. So a great idea and great option. So this plan, again, makes it easy to have, makes it easy to use. And again, I'll show you a little more with Dr. Marion here in a minute. If you would like to know more about this, just give me a call. It's super easy to sign up, very easy to put into place. So just either send me an email or give me a call and I'll be happy to help you out with it. And I hope you found it valuable. Hope you have a fantastic day and stay tuned for Dr. Marion.
One of the country's foremost experts on caring for seniors.
Marion Summers, also known as Dr. Marion, is an expert in elder care.
We need some help here, so we called in the big guns today. Dr. Marion joins us.
NBC News In Depth tonight. We continue our special series, Trading Places, on taking care of aging parents. This week we're looking at your stories, and one of the things that has come up in the well over 5,000 emails and pictures we've received on this topic, the issue of long-term care insurance.
Yearly premiums can run you anywhere from around $1,000 to several $1,000s, depending on your age and the options you choose. Dr. Marion Summers is a geriatric care manager in New York.
And with us is Marion Summers, whose PhD is in human and organizational development with a specialization in retirement, and she's also the author of Elder Care Made Easier. Hello to you.
Thank you.
Hello, I'm Dr. Marion. I've been in elder care for over 40 years, and elder care is my passion. I've traveled the country many times on bus tours, and I have gone from the state of Washington to Washington, D.C. And the tours are all about educating and alerting America about long-term care. Remember, a failure to plan is a plan to fail. On my journeys, I have met people and been introduced to products and services, and there are some services out there that have not gotten the attention they deserve. Specifically, I'd like to bring to your attention a product called True Freedom. This is a product from American Senior Services Incorporated, also called ASSI. I have first-hand knowledge of this product. ASSI has been in business since 2008, and they are a viable alternative to traditional home care services. ASSI only uses bonded, insured, and licensed providers, unless the client chooses to use the friend or neighbor plan. The True Freedom product offers companion services and home care services such as meal preparation and laundry, assistance with dressing, bathing, and toileting, personal hygiene, and even accompany someone to the doctor. ASSI's response time is very quick, 24 to 72 hours. Now let me tell you what makes the True Freedom product unique. There's zero underwriting, zero age limitation, and no prior hospitalization is required. I strongly urge you to take a look at this product when you are formulating your long-term care plan. It could be additional protection to work in coordination with your long-term care insurance. Remember, when looking into a company's profile, make sure that they have their credibility in order. For instance, when I reviewed American Senior Services Incorporated, they had the highest rating with Dun & Bradstreet, and they had an A rating with the Better Business Bureau. So check out American Senior Services Incorporated and their product, True Freedom. www.truefreedomhomecare.com.
The good news is, today seniors are living longer than ever before. The problem is, as we grow older, life becomes more challenging. Statistics show 3 out of 4 seniors will need some form of home care in their lifetime. The solution most people are aware of is a long-term care nursing home policy. The problem is the strict underwriting conducted in order to be accepted. Even seniors who appear healthy are rejected because of their health history, prescription medications, and more. And these days, long-term care policies are primarily written to people ages 45 to 64. So, for people 65 and older, now what do you do? True Freedom Premier Plans from American Senior Services Incorporated are the most viable alternative to long-term care insurance today. With a True Freedom membership, you're purchasing access to home care hours that can be utilized when you need them. The plans feature no underwriting, no claim forms, no deductibles, and no age limits. True Freedom plans are available and identical in all 50 states. Clients select one of 4 available plans containing the amount of hours they prefer. When service is required, the member simply calls a toll-free number to the customer care center. They set up your care, coordinate the hours you specify, and pay the bills. One call does it all. Think of it like a home care concierge plan. And because it's a membership, there are no health triggers to receive service, no claim forms, and no paperwork. The plans arrange personal care assistance for things such as dressing, bathing, hygiene, meal planning and preparation, grocery shopping, light cleaning, medication reminders, being accompanied to doctor's appointments, and more, all from the comfort of your own home. A senior's safety and wellness at home are what's most important. That's why the plans allow you to receive service from a licensed home care agency or gives you the freedom to select a trusted friend or neighbor to assist you at home. Most healthcare coverage does not include this type of service. Are you the child of an aging parent? Does your work, current location, or ongoing responsibilities prohibit you from being there for an elder loved one? Tell them about True Freedom Premier Plans right now. True Freedom Plans can arrange for care up to 24 hours a day, 7 days a week service. The value of plan hours automatically increases with the cost of home care over time, and members are rewarded with a decrease in membership fees the first 4 years if no home care service is utilized. American Senior Services Incorporated is backed by an experienced management team working with seniors for over 30 years. They have the highest recognition and endorsement by Dun & Bradstreet and have earned their A+ rating with the Better Business Bureau. Find out how a True Freedom Premier plan can bring peace of mind and security to your family by contacting a representative today.